Knowledge of how to perform cardiopulmonary resuscitation, including opening the airway, administering rescue breaths, using high-quality chest compressions, and ensuring early use of an automated external defibrillator, is highly recommended before you take this course. This course provides basic understanding of the opioid epidemic, the symptoms of an opioid overdose, how to recognize and respond to someone who might have overdosed on opioids, and care after an overdose. After completing this course, participants should be able to meet all of the following 7 objectives. Describe the current opioid epidemic in the United States, identify some prescription and illegal opioids, recognize why opioids are so addictive, identify a possible overdose and how to respond to it, identify the antidote for an opioid overdose, understand what naloxone is, how it works, and how to give it to someone who has overdosed on opioids, recognize the importance of treatment options after an opioid overdose. America is facing an opioid crisis. Every day, more than 128 people die after overdosing on opioids. That was 46,800 in 2018. Drug overdose is a leading cause of accidental death in the U.S. Most drug overdoses involve opioids. Many people were first exposed to opioids through a prescription for pain relief. Because prescriptions for these drugs are very common, the person who overdoses may be someone you know, a coworker, a friend, someone you love. What can you do to help? We can trace the beginnings of the prescription opioid crisis to the early 1980s. At that time, the medical community was seeking better ways to treat the growing number of patients with chronic pain. And pharmaceutical companies were also introducing new synthetic or man-made opioids. The marketing for these drugs downplayed how they might be addictive. In 2018, 2 out of 3, or 67%, opioid-involved overdose deaths involve synthetic opioids like fentanyl. Properly dosed prescription opioids are important for treating patients who have acute and chronic pain, need end-of-life care, or have cancer pain. Some of these drugs are natural. Many are synthetic. Here are some of the generic and brand names of prescription opioids you may have heard: hydrocodone or Vicodin, oxycodone, or OxyContin Percocet, oxymorphone or Opana, codeine, fentanyl, morphine, or Cadian. Here are some street names for illegal opioids: Captain Cody, Doors and Fours, Pancakes and Syrup, Apache, China White, Monkey, Oxycat, Hillbilly Heroin. There are many other names for both prescription and illegal opioids. Refer to the street names for common opioids in the resource file on this site. Opioids work on the reward center of the brain and are highly addictive. Because of this, people continue using the drugs. The reward or high that these drugs give is why they are often used for non-medical reasons and are sold illegally. Why are opioids so much more addictive than other drugs? Opioids act on multiple brain regions and alter how the brain works. People who take opioids for a long time need more of the drug to get the same high or reduce their pain. This builds their tolerance. When people who are addicted to opioids stop using them, maybe after staying in a hospital, detox center, or jail, they lose their tolerance. Using the same doses as they took before can be life-threatening. An overdose occurs when someone takes more opioids than the body can handle. This results in unconsciousness or passing out, and very slow or no breathing, which can cause death. How can you recognize an opioid overdose? Here's what to look for. Check. Is the person hard to wake up? Have they vomited? Listen. Are they breathing with very slow or shallow breaths? Are they snoring or making raspy, gurgling, or choking sounds? Are they not breathing at all? Look. Do their lips, fingernails, or skin look blue? Are the pupils of their eyes really small? Touch. Does their skin feel sweaty? If you think or know someone who has had an opioid overdose, immediately phone 911 or activate your emergency response system. People who have overdosed can quickly get worse and need medical care. After you have phoned 911 or activated the emergency response system, what should you do? If you suspect opioid poisoning, you should first follow the steps in this algorithm. Check the person for responsiveness. Shout for nearby help. Activate the emergency response system and get naloxone and an automated external defibrillator, or AED, if available. If the person is breathing normally, it's important to prevent deterioration. Be sure to tap and shout, reposition the person, and consider using naloxone. Continue to observe and assess the person's breathing until emergency medical services, or EMS, arrives. If the person is not breathing normally, start CPR immediately. You should also administer naloxone and use the AED. Be sure to resume CPR until the EMS arrives. To review, if the person is responding and breathing, phone 911, get naloxone and an AED if available. If the person is not responding but breathing, phone 911, tap and shout, reposition, and consider giving naloxone. If the person is not responding and not breathing or is only gasping, phone 911, start CPR, give naloxone, and use an AED. We just showed you when to use naloxone, but do you know what it is? Naloxone reverses a life-threatening opioid overdose. Naloxone works only on an opioid overdose. It doesn't work for other types of drug overdoses. Naloxone comes in different forms. It is available in most states without a prescription. When someone has had an opioid overdose, they need medical help right away. That's why many states have taken steps to protect people who respond when they see someone overdose. Currently, 40 states and the District of Columbia have some type of Good Samaritan or 911 drug overdose immunity law in place. These laws protect people from arrest or prosecution if they try to help someone who has overdosed. Some states also have made naloxone available without a prescription so that it's easier to treat an overdose. For example, some states allow people to request naloxone directly from a pharmacist. Some even allow community groups to provide naloxone to high-risk populations. These Good Samaritan and naloxone laws vary by state, so review these links to find more information about the laws for your state. There are 3 ways approved by the U.S. Food and Drug Administration, FDA, to administer naloxone: nasal spray, auto-injector, and injectable. How to use naloxone nasal spray, or Narcan. Number 1, take the nasal spray out of the box. Number 2, peel back the tab to open the nasal spray. Number 3, hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers, on either side of the nozzle. Number 4, insert the tip of the nozzle into one of the person's nostrils. Number 5, press the plunger to give the entire dose of naloxone. Take the nasal spray out of the nostril. Number 6, if the person doesn't respond within 2 to 3 minutes or stops breathing, use a new nasal spray to give a second dose of naloxone in the other nostril. How to use a naloxone auto-injector, or EVZIO. Number 1, take the auto-injector from its outer case. The auto-injector has an electronic voice system that gives step-by-step directions. Number 2, pull off the red safety guard. Number 3, press the black end firmly against the person's outer thigh. This can be over clothing if necessary. Hold in place for 5 seconds while the autoinjector gives the dose of naloxone. Sometimes community programs may give out naloxone that comes with a nasal atomizer and a syringe. Follow the manufacturer's directions. Number 1, pull or pry off yellow caps. Number 2, pry off the cap. Number 3, grip clear plastic wings and attach the white cone to the top of the syringe. Number 4, gently screw the capsule of naloxone into the barrel of the syringe. Number 5, insert white cone into the nostril, give a short, vigorous push on the end of the capsule to spray naloxone into the nose. Spray 1/2 of the capsule into each nostril. Number 6, if the person does not react within 2 to 5 minutes, give the second dose. How to give naloxone with a syringe. Number 1, take the cap off the vial and stick the needle through the rubber stopper. Number 2, draw all of the fluid into the needle by pulling back on the plunger. Be sure the syringe fills with liquid, not air. Number 3, inject the needle straight into the muscle in the person's shoulder, like a flu shot, or into the front of the person's thigh. Push down on the plunger to empty the syringe. It's okay to inject through clothing. Number 4, if the person doesn't respond in 3 to 5 minutes, inject another dose of naloxone. Do not wait more than 5 minutes to give a second dose. After you give naloxone, it may be very uncomfortable for the person. In some cases, the person may become aggressive or violent. Be prepared for that reaction. If you are a family member or friend of someone who has had an overdose, what can you do to help? If someone has had an opioid overdose, it's very important that they get follow-up care. After an initial overdose, it is not uncommon for the person to have a fatal overdose within a year. Opioid addiction is a complex problem that needs different kinds of treatment. So you should encourage people who have overdosed to go to the hospital. The medical staff can help treat them and provide resources for longer-term substance abuse treatment. One of these proven methods for treatment is called medication for opioid use disorder, or MOUD. MOUD uses prescription drugs, counseling, and behavioral therapies to treat a person with an opioid addiction. Encourage people who have overdosed to discuss MOUD, substance abuse treatment, and other types of treatment with their doctor. Because so many people take opioids, you may need to help save the life of someone who has overdosed. This course shows you how to quickly recognize and respond to an opioid overdose. But opioid addiction does not stop after an overdose. It's a complex problem that needs different kinds of treatment. So keep encouraging the person who has overdosed to get medical help. To learn more about resources for those who've had an overdose or who have an opioid addiction, please see the resource file on this site.